A chronic total occlusion, or CTO, is an artery of the heart that's 100% blocked and has been for at least 3 months. It is important to address the symptoms that patients have with CTOs because potentially those symptoms can be very limiting in terms of impairing one's ability to pursue activities that they want to pursue. And that's the typical patient where we try to treat the CTO either with medication or with interventional techniques that have been developed where we can actually open up these 100% blockages. Initially, medication is the treatment of choice. If a patient has control of their symptoms with medication and they're doing the things that they want to do, then that's a perfectly acceptable therapy for a patient that has a chronic total occlusion. But if you have active patients who want to pursue greater levels of activity and are limited by angina or heart pain once they exceed a certain level of activity, and that impairs their lifestyle and their quality of life, that would be an indication to go ahead and try to open a chronic total occlusion. People that will develop CTOs include those patients that have any risk factors for coronary artery disease, which includes diabetes, smoking, high blood pressure, hyperlipidemia, aging. All of those are significant risk factors for heart disease. Interestingly, when we do diagnostic heart catheterizations, it's estimated that about 1/3 of patients will actually be identified as having a totally occluded artery, which is much more than one would expect. The patients that develop these have the same risk factors as anybody that develops any other type of blockages in the arteries of the heart.